It's great to be here with you. Thanks so much, everyone, for joining us today. Haven't Jonty's talks been fantastic? Now, Habakkuk may not have known about ventilators and vaccines and face masks, but he knew what really mattered. He knew that God was the rock to stand on when everything else was falling apart. Now, as John's just said, I'm the chief executive here at CMF, and I'm also a prison GP in London. Every day, I am encouraged to hear what God's doing in the lives of our members through the ministry of CMF. Now, this COVID crisis has given us a lot of problems, but it's also given us some huge opportunities. And this amazing online gathering is just one of them. The world will never be the same again, and neither will we. So I'm really looking forward to hearing Patrick Dixon's talk on what that future might look like. And CMF, as you've heard, is almost as old as the NHS itself, and we're considering our future priorities. So here's just a flavour of 5 areas where we think that God is leading us. First, in improving our communications. Now, lots of organisations are already moving more from print to digital, increasing the use of social media, WhatsApp and Zoom, and COVID just accelerates this. So in our autumn conferences this year, even if we can meet physically, we're planning to offer online engagement as well for those who can't join us physically. There will always be a place for paper and for physical meetings, but we're just starting to glimpse what might be possible as we shift more emphasis to digital and to virtual communication. Secondly, we'll be extending our reach. Now, CMF is the premier community of Christian health carers in the UK, but there are still far too many who don't know about us or who only know one small aspect of what we do. There are many church networks, ethnic groups, and geographical areas where we're just not very well represented. And our goal is that no Christian should be alone in the NHS, but every NHS workplace should have a praying Christian presence, and that every church network should know who we are and what we offer. Thirdly, we'll be developing our partnerships. We already work with many different groups whose work overlaps with ours. Some of them work in public policy. Some of them are global umbrella bodies like ICMDA that you've just heard about, or NCFI for nurses. We already work strategically with them, but there is a lot more that we could do together. Fourthly, we're going to be building our exciting nursing and midwifery ministry that you've just heard about, and also supporting other groups of allied health professionals. We've currently got over 300 nurse and midwife members, and we've been delighted to see that side of our ministry grow. But there is still a vast unmet need, a vast ocean of unmet need and of untapped resource as well amongst Christian nurses and midwives in the UK. There are also many Christians in the other allied health professionals, and yet most of those professions don't have any organised Christian witness. Each of those professions has got its own challenges and its own priorities. So although we don't plan to widen our own membership further, we want to help our brothers and sisters to rise up, form their own networks alongside CMF. And finally, we're going to be improving our local networks. We've recognised for years that CMF has strong central events and resources, but very often this doesn't translate into vibrant, supportive local communities. John's going to be telling you more about that next, but we want to continue making the resources of CMF a reality in every locality. So that's a little flavour about what where we think God's going to be leading us in the next phase of our life together. We're going to be developing those ideas in the coming months, and that's going to be starting with our AGM on the 13th of June. We'd love to hear ideas from any of you, so do please send your thoughts to engage@cmf.org.uk and watch out for more opportunities to contribute. I want to finish by just talking about 2 pillars that underpin everything else that we do at CMF, and those are membership and partnership. You know that CMF is a membership organisation, and we rely very much on our 5,000 members. Everything that we do is focused on uniting and equipping our members to be more effective as they live and speak for Jesus. So most of our resources, our events and our local networks are open to non-members, just like this one is, and we really want to keep it that way. But we also really want to promote CMF membership. It's a form of missionary giving to a strategic people group. It's not just about what do I get for my subscription, like it might be with a gym or with Netflix. Everyone who joins CMF helps us provide more resources for more of our colleagues, many of whom are not well supported. So do please consider joining CMF if you're not already a member as part of your missionary giving. You can do that at cmf.org.uk/join. The second thing is partnership. CMF is a fellowship of believers. We're all in this together, and we certainly need each other. So we need to partner in prayer, whether that's through our regular prayer diary or through the COVID-1900 prayer initiative at the moment. We're really dependent on the Lord, and the prayer of our members is absolutely crucial to that. Secondly, we need to partner through engagement, and John's going to be talking more about that in a minute. But broadly, whatever you're passionate about as a Christian medical nurse, there are probably others within CMF that are passionate about the same things. So don't worry if there are some things we do in CMF that don't connect so much with you. Look for the things that do connect with your passions and get in touch, because there will almost certainly be others that share those. And then finally, we do need to partner through financial giving. I've mentioned this last because we're not here to drain your wallet, but healthcare workers in general, particularly doctors, do tend to have a higher level of secure disposable income than most people. And CMF's ministry would be so much smaller without the financial contributions of our members, many of whom are able to give over and above their subscriptions. So we're really, really grateful to all of those who can and do help us financially, and it really does make a difference. The next few weeks, we'll be launching our Spring Appeal. It's going to be focused on sustaining the resources that we're currently pouring into this COVID crisis that many of you have experienced and benefited from. And it's really essential for our ongoing budgeting and staffing. So do look out for that, and do please think and pray about whether you might want to contribute to that. The membership and partnership, those two pillars that are absolutely crucial to help us continue to unite and equip Christian doctors and nurses to live and speak for Jesus. That's today, tomorrow, and into the future.